Let us all put 888 in the chat box as an applause to welcome Dr. Tham on stage. Welcome, Dr. Tham.
Yeah, okay. Thank you, Hui, for a very good introduction. Good evening, everybody. I just want to wish you blessed Christmas and Happy New Year coming up. I have a passion for this topic because I hope if you know this, you don't have to land yourself in hospital too early. Okay. Tonight's talk will be something that is from my heart. And I hope I have seen many cases over the last 12 years, and just to begin, how did I know this particular science that I have in my hands? Is back 12 years ago, I met this CEO of Pfizer who happened to have fourth stage cancer, and just to cut a story short, he recovered within 2 months, although he was given 2 months to live. The person who introduced it to him was also a cancer patient, fourth stage nasopharyngeal cancer. And given 2 months to live, he also recovered. So from these two stories that really trigger me, I become very curious about what is this science all about? If such serious disease, it can help, there must be something behind this. So I took on the effort to learn more, attend the classes, and over the 6 months, I've seen enough in my own eyes, and I decided to make a decision that I would bring this to the world. And even I've told my own group people, even if you don't share, I will share on the street. Because I believe in my heart, I've seen it with my own eyes, and this thing can talk one. Okay? And so welcome tonight, because I hope what we share will really give you a newfound way of approaching holistic wellness and disease. Okay? So let me begin by just sharing, I call it the gift of life. Okay? And it's the latest medical breakthrough in preventive healthcare. Now, I don't know whether you all know or not, the total cost of managing and treating chronic conditions is staggering in US. The CDC, estimates that 90% of all healthcare costs in US go towards treating chronic disease and mental health. It's staggering, 3.7 trillion, not million, not billion even, a year. How much, people are experiencing chronic problem in their life. Okay, so this is a big thing, and that's why today I was talking to one United Nations Geneva people. They said there are not enough hospitals. They need to build more. So what does that mean? So more people are facing this problem now. You see, even the medical cost is increasing in the insurance industry. Prudential, the latest claim payout data report, paid $2.04 billion in claims in 2022, an increase from 2021, 25% to about 26% increase. And AIA also experiencing the same amount of payout. So you can imagine the treatment for chronic disease. Okay, so more and more people have to pay more increased medical cost premium. And there's a lot of people, the older ones, the senior people cannot afford anymore. Okay. Now, what is acute and what is chronic? You must understand. Okay, acute means what? In medical terms, acute refers to a condition that appears suddenly and lasts for a short period of time. For example, you have a sore throat, a fever comes suddenly. And normally, if you don't take drugs, it will take about 7 days for you to fully recover. While chronic describes a condition that develops very slowly but persists for a long time. And normally more than 3 months, we consider the problem chronic. If you're having a problem coughing for 3 months, more than that, is a chronic problem. Okay? So essentially, acute means short term and severe. It becomes very severe suddenly, Chronic means long term and ongoing. So you find a lot of problem like this, you see psoriasis, arthritis, diabetes, all these are chronic. It doesn't go away within a week. Sometimes it takes you a lifetime if you're not treated properly. Okay, many people are on medication, but the problem still persists. So it's not a cure, it's just a management. Okay, so this is the problem faced by a lot of people now in the world. Psoriasis normally due to uh, emotional trauma, depression, that will trigger psoriasis. Arthritis is more autoimmune. Somehow maybe due to pressure, the immune system attack its own cells. Thyroid, 盲肠, sometimes ladies they always very 盲肠, very irritable and all this all the time. Then you get this. The body has to balance itself back. Obesity is a chronic problem. Okay, by 2030, half the world become obese. In Malaysia, we are called the sweetest nation in Asia. Okay, many people become diabetic. Cardiovascular now is more and more and more. Now, I want to share with all of you is please take care of your heart. Because a lot of cases recently I saw was there's a damage to the valve wall, a damage to the aorta. I don't know, probably it's due to the spike protein because it doesn't come suddenly like that. So those who are on the Pfizer vaccine, please really take care, But the next talk we have will be on vaccine side effects. Okay. Now, asthma, there'll be more and more. So, the asthma, see? Asthma can be due to skin problem, can be due to maybe the vaccination also. Okay. There are enough cases where you show that skin problem and all this are due to vaccination. There are a lot of studies on that. Now, if you look at the medical research, 90% of diseases are due to imbalanced immune system. Okay? I don't know whether you understand what imbalanced immune system means. There are two types. One is overactive. Okay? You get autoimmune. There are a lot of people getting autoimmune disease nowadays. Many. Okay? If you go to hospital, they give you what? They give you steroids. They give you penicillin. All these are going to cause great damage to your kidney and the liver. Okay, many people die because of the penicillin side effects on the kidney, die of kidney failure, rather than the autoimmune disease. So allergies, sinus, all these are all active. The one you show is you just seen just now, arthritis, asthma, all these are overactive immune system. Okay, and many people in the world are facing this. I'm sure if you look at your neighbor, your friends, you'll see this. People are suffering from this overactive immune system problem, which is part of the chronic disease problem. Okay. Now, this is a case of psoriasis. I've personally invited him, Teck Chuan, to come and share how he suffered and how he got cured. Maybe I invite Teck Chuan to come and share. Teck Chuan, are you there? Yeah, you don't mind you just share your story? Okay, thank you, Teck Chuan, for your amazing recovery from psoriasis. In fact, I was in Thailand, I asked one of the TCM doctor in Thailand. I said, do you have a cure for psoriasis? He said, in the whole of Thailand, there's no cure. So today, if you attend this session, you have found something, a cure or alternative way to treat psoriasis. Okay, if you have a friends outside, if psoriasis can be treated, what about skin problem? Definitely we can help them. Okay. So I will go to the next slide. This is eczema. Okay, many people have eczema now. Okay, children especially, and normally even after the COVID, the spike protein from the COVID or the spike protein from the vaccine can cause eczema. Okay, and why eczema? Because the body wants to balance what's inside. The body wants to throw off the toxins, and so it comes up in the form of skin problem like that. So if you don't apply steroids, please, because what comes up from the body is a sweeping out of the rubbish from the body. If you use steroids, you will sweep it back, you suppress the problem, and you will never get cured. Okay, the more you use steroids, the more you go in, you come out in another different place, you have to treat again and again become worse and worse and worse. Okay, so we have a way, this is an overactive immune system, we can balance it back. Okay, thyroid, also another overactive immune system. I'm sure a lot of now with a lot of pressure and stress in the world, many people have thyroids, and especially the mothers, the women who always very mangzang, irritable, hot temper, all this will come out. If this thyroid don't come out, you will have a heart problem, you will have stroke. Okay, so the body is trying to balance it out for you. So please take note of that. We have a way to balance it back and swing it back to normal. Okay. Now I want to share an asthma story. A few days back, but I just got this slide out. I met this person, asthma. She came and see me. She was breathless. Her lungs were very painful when under pressure. Side pressure also painful. So the oral diagnosis I made was overactive immune system. Many years she has been on drugs, antibiotics, steroids, penicillin, painkillers, antidepressant drugs as well. So still no improvement, but experienced other problem like flatulence. Now, when you take a lot of painkillers, you will create a lot of stomach flatulence. There's a side effect of painkillers. So many people are suffering like that. You do not know until we take their case. Then you see many people are suffering, and they don't get the results they want, and they really, that this lady is really at night very scared to sleep because sometimes she cannot breathe. Sometimes so you share with people, we meet people like that, And then asthma, we can have, I show this patient, asthma 30 years also recovered. Okay, he has facing problem, breathing problem, difficulties to sleep. But after he took what we gave him, he actually now breathing normally and no more on drugs. Okay, like one of the case for the autoimmune disease, this famous pretty actress Cathy Chow was found unconscious after unsuccessful treatment of her SLE, which attacked his own tissues. This is an overactive immune system state. Many are suffering in the world, like arthritis, asthma, thyroid, like which I've said before. And actually, mainstream has no medicine, only using steroids, which does not treat but suppress the problem, affecting liver and kidney as well. So, do we have a choice? Does mankind have a choice? We have. Tonight you are here. You are very blessed. You can find the way, the alternative way, effective way, natural way, safest way to treat this kind of problem. If you land yourself in hospital, even if you think you have a medical card, you're going to spend all out, finish spending on your medical card, you still don't get well. Okay, so this is the thing that we are sharing with people. SLE cases, we have many, you see, all recovered. Just trying to show you, no? So besides the immune system dysfunction means overactive, there's such thing as immune system also very weak. But why people can get cancer? Because the immune system is very weak and you get infected. Lately, I don't know, there's a bug in town. Many people are coughing, sore throat, all these things. If the immune system is not strong, you will get affected. Recently, there was a write-up, those who sleep normally 8 hours, and then suddenly next day you sleep only about 4 hours. Your immune system is severely affected, Your NK cells drop by 70%. So why is it people who don't have enough sleep fall sick very easily? So make sure you have enough sleep and you boost the immune system to the highest level. Okay. Now this is another lady. Actually, I wanted her to come in, but she moving house, so she couldn't come in. She is a cancer patient herself. She after being treated on chemotherapy, she went on the oral chemo drug called tamoxifen. So after taking to a few months, she developed this fallopian tube obstruction, and it has to be operated. But luckily, she found one of our good people, Dr. Cha, and Dr. Cha said, "Why not you try?" She tried, and I think after 1-2 months, I think she don't have to go for operation. She's very happy, and now she's sharing this science that I've been promoting to many people, to her friends and relatives as well. Okay. Now this is a very very amazing science, miraculous science, miracle testimony. The person suffering from pancreatic cancer. I don't know whether you know about pancreatic cancer. It's one cancer that is the most worst form and difficult form of cancer. And no wonder the Russian government approved for use to treat all chronic disease, including cancer in all hospitals and clinics. After they done their studies on autoimmune, HIV, hepatitis B. I wish I have more time to share on this, but this is not easy to treat pancreatic cancer. Most of them not around one. Okay. And you see this person, was skinny during the cancer time. Now he put on weight. Okay. This is another case, a miracle case also. I will ask Kenny to share this case because it's a really a miracle case. Kenny, you mind?
Yeah, yeah. Dr. Tham, thanks for inviting me and giving me time to share this incredible, amazing testimony that we have to help and save this child. Very unfortunate, this child that been that the time when I met her, is actually she's a 16-year-old girl, but having a tumor for 8 years. Means that since 8 years of age, she was already having this. And the size of the tumor was incredibly big. Imagine about 12 centimeter is equivalent to about two tennis balls inside her brain. At the point of time, and actually the case was handled by Roger, a friend of mine, and Roger actually handled the case very well. And when I took this photo when the mother fit her with the later Dr. Time will talk about the transfer factor, right? I fit her in fit tubing. The doctor prognosis her. The prognosis was actually about 3 weeks to 4 weeks of time, and it's under palliative care. Because for 8 years, the treatment went through all kind of treatment, chemo, surgical, and even radiation, but it doesn't matter to help anything. Like what Tekran mentioned, there's no more cure to the medical terms until she was introduced by Roger, the person introducing her, this child, to the parents, the gift of life of cancer factor. And the good news that she not only go beyond the prognosis of just 4 weeks, she lived right now until today, and that was 9 years ago. And she's about now 20, 24 years old. And I just got an update that the tumor size reduced significantly to around 60 to 70%. This is incredible because never in the science that if nothing been done, right, the size of tumor will not able to reduce by itself. But we know our body can do that work. And Dr. Tam will explain it later. How does it work? How does our immune system able to reduce the tumor without any treatment anymore? So this is actually a real case happened in Unity, Malaya, and also was documented about this case. And the doctors are very unbelievable. It's a miracle for them, and even asked the parents to send back this girl to do a lot of investigation on how come this case able to recover miraculously, right? So thanks, Dr. Tham, for introducing this, and it helped a lot of people, and thousands of lives have been changed, including myself. So that's my sharing today. I pass it back to you, Dr. Tham.
Thank you, Kenny, for sharing. I want to comment on brain tumor. We have many success stories in brain tumor. We have many cases. Okay, if you sit down with me, I will show you all the cases. But because of time limitation, I can only show you a few cases. So I'm very happy this child, she's on a wheelchair, and the father pushed the wheelchair to us and said thank you. I was very blessed and happy that we can help her. The mother actually asked us, "Doctor, can you help her?" I say you don't have a choice. The doctor give you 2 months to live only, the doctor, and now she survived up to today. So next one to share is what. We'll start. So to summarize, the immune system dysfunction, you have overactive on the left side, weak immune system on the right side. So tuberculosis, all this for lung infection, for pneumonia, this science is this is a very powerful thing. I've helped many people, in coma state, in having a lung infection, pneumonia, H1N1, they in coma, they woke up. So I'm sharing with this, if you come across people who are like that, contact the person who actually invited you and ask for their help. They'll be very happy to help you all. And then there are a lot of cases like skin, all this problem. You don't use steroids. You just treat it immunologically, and then you see the results. Okay. Now, if you look at supplemental revolution, you'll find that over 1970 period is talk about vitamin 1. Okay. 1980, another 10 years later, we talk about herbal revolution. And that's where the Herbalife came in, and 1990 antioxidant, and then with Ozana and all this new skin that came in. But the 21st century is now about immune system revolution. Now, especially after the pandemic, everybody is aware of the immune system. Your immune system is not strong, then you will face a lot of problem, right? If your immune system is overactive, many people do not know that immune system is overactive. Okay, and we need to find something that can deal with this overactiveness of immune system. Okay. Now, when we talk about immune system, we definitely have to bring in transfer factor. Now, today, this is a science, a healing solution. Transfer factor is an intelligent molecule. Listen to what I say carefully. This is very important. Transfer factor is an intelligent molecule extracted from the immune system. Okay, and for the immune system, it has the immune IQ to help balance immune system, educate the immune system to play its proper role. Whereas you say the nutritional world, the herbal world don't have this immune IQ. That's the big difference. Okay, even the vitamin don't have that. Okay, so there are two main functions of transfer factor. One is it has the ability to balance back the immune system. That's why you see Techuan recovered. That's why you see asthma recovered. That's why you see the skin problem recovered, the arthritis recovered. The autoimmune, I show you cases like that, also recovered. You have to find the one thing in the world that knows how to balance the immune system, and that's transfer factor. If you can find another thing for me that can balance the immune system, you let me know. I also want to know, because I'm in the quest for better health. Okay. You see, there are a lot of studies in the International Journal of Immunology and Immunotherapy. They have already said TF is an immune modulator peptide. Okay. Now, there are a lot of studies to back up that for-life transfer factor formula may help bring the immune system back to a state of rest. So you will find that people with sinus, especially children, sinus, eczema, you give it to them, but you don't have to see it. We respect the doctors, right? You will see the result very good. Okay. In the Woodland Health Report, the miracle molecule that outsmart disease is called transfer factor. Why is a miracle molecule, the outsmart disease? It's because it knows how to deal with the immune system. It knows how to balance back. Okay, so this is another function of transfer factor. I call it the antivirus detection and protection software. Now, how do the transfer factor modulate the immune system? Is by educating the immune system to remember, to recognize, and then to respond. This is what happens in, like you get chicken pox, right? Why the person after chicken pox don't get back again? Because it's because of this protection software, because of these 3 R's. Remember, recognize, and respond. Now, remember means when a person is under health threat, the immune system is recorded, that particular virus in the data system of the immune system. And all the traits, everything is recorded there. And when they recognize next time another chickenpox virus like that come in, they can respond very fast. So this is something that you cannot find in the nutrition, in the vitamin, in the herbal world. This is already inbuilt, this system, and they can do the job. Okay. Now you find nutrition, strengthen immune system, what we educate in smarten the immune system, a lot of difference. The other function is, besides balancing immune system, is it can amplify the value of herbs and nutrition. For example, vitamin C, it decreases oxidation by 12.4%, right? But if you add transfer factor to vitamin C, it will increase by 80%. That means oxidation will reduce by 80%. What does it mean? Your inflammation reduced. And if you talk about anti-aging, it will reverse aging. Okay. Now, this is a very important study. You must know that if you don't simply say and recommend it to people, there's a study done on transfer factor and other products in the world. And it's a study of 196 natural products over 7 years. Okay. All the herbs and all the products listed here, you can see they have tested. And many people don't have this kind of test. Okay. Now, why do they want to test? Like garlic, aloe vera, and all this, shiitake mushroom, all this, bee pollen, all this. Because they want to find out what products do you take in the world can boost the immune system by how much. This is the top 10 of immune system product in the world. Noni juice, aloe vera, only 15%. Colostrum, 26%. Cordyceps, in China, it's called Dongsong Xiacao. It's very expensive, 10 grams, at least now, I think about $3,000 already. You can boost up to 28%. Shiitake mushroom, a form of Japanese mushroom. Echinacea I used to take last time 10 to 23 years ago. And the highest is the mangosteen juice, 76%. The skin of the mangosteen juice. You see our transfer factor can go up to 283%. Boost the immune system. Pure one, the pure form. But because we add some result, some 10 best immune system herbs in the world, we add with transfer factor combined, it can boost up to 437%. And there's no joke. This is the highest immune system boost in the world. And I call it the most powerful immune system booster. If you take this, if you have a sore throat, recently my daughter all kena, sore throat, and granddaughter all kena, they take today all okay already. Okay. Now, increase by 437% means what? The natural killer cells. This is the one, the immune system assassin. That means it will kill all those the elite commanders. The new virus coming, they will kill it. Okay, and especially for cancer, it will shrink the tumor cells. It was by at least 97%. You look at this page. This is a study done by the Russian Oncology Research Center, by the Russian Academy of Science. You see, when they use transfer factor to compare with interleukin-2, this is the immunological drug, used by their hospitals, and they combine. After 40 hours, you see, we can boost cancer cells, NK cells by 47 to 389. Now, if you do this kind of NK cell treatment, they call regenerative medicine. In Japan, you have to pay at least 60,000 US. In Malaysia, about $100,000 using NK cell treatment. Interleukin-2, you go to Singapore and do this treatment, is an immunological drug treatment. is $100,000. Okay. Now, what does it do? What's the benefit? It kills cancer cell 97%, and interleukin-2 only perform 80% killing rate only. Now, this slide I have shared with many cancer patients, and those who believe they really got a very good chance to live and survive. And this is an alternative for mankind to choose one of the ways to treat cancer. Chemotherapy, to me personally, my own opinion and my research, is chemotherapy is poison. Okay, and if you only have 3% survival rate, you really have to consider what treatment to do. And I just recently have one case. I think it's a breast cancer case, and it happened to my mechanic accountant, and she passed away. Okay, so I tried to share with her, but some people don't listen. So I cannot. I just sharing only. Okay, I'm sharing a science. That's like sharing a wanton mee is nice. You like, you go and eat. You don't like, I cannot force you, right? Nobody will force you. But this is an alternative for mankind. You explore the study. This is done by Russian Academy of Science for many types of disease. HIV, like I mentioned before, cancer, all this, they have tested already. That's why they approved for all hospitals we use in Russia. You see, this is 500 times more powerful than all the nutritional products in the world. This has been tested, Show this. In fact, the IgA also increased by 73% more. Okay, for people who take this transfer factor, after a period of time, 100% people tested, they increased 70%, 73% more. This is another study that this is a Taiwan study. NK cell is red color, right? You see red color. The greener color a bit is the virus, the pathogens. After 40 hours, you see the NK cell makan all the pathogens, So this is a 48-hour study, okay? Recent study. In less than 2 hours, we can activate the immune system. There is only one product in the world that can activate the immune system in less than 2 hours. Okay, so you are very blessed to know this, because you take a lot of products people don't know, right? People say, like Kenny was mentioning, this one will boost immune system, like Ketchuan was just mentioning. But how much and how fast? We have already studied, research already. So I want to share this so that you all know, every product is good in the world, but you deserve to have the best. Okay. Now, there are more than 4,000 clinical studies in the world. Very science-backed, fully science-backed, this transfer factor. Okay. Like I say again, approved in Russia for use. Okay. And Physician Death Reference is a reference book for doctors, stating that there's no side effects and no toxicity. And we have this company got a lot of products inside there, compared to other companies, So they're very well recognized and well researched. I'm just showing you again that it's a historic move. The Ministry of Health, Russian Federation, given approval to such a supplement. They call it a supplement for use in all the hospitals, in Russia. And this is, if Russian hospital can use, you should have no doubt about it. Okay. I will ask Dr. Jovi. She has used transfer factor before, and maybe seek her to brief us briefly on what she think of transfer factor. Dr. Jovi, you don't mind you come in?
Okay. Thank you, Dr. Tham, for calling me. I've been looking for supplements that are God-made, natural, that have no side effects, no toxicity, and no non-overdose. I had been looking for this kind of thing for so many years, and I was always told that there is no such drug or any supplement. But finally, I found it in transfer factor. And I am very happy that this transfer factor is effective just as it claimed. I had been taking it for some time, and I found that the most thing that I found first thing was that I had more energy when I took it. And then the next thing I noticed was my circulation was better because I always had cold extremities, cold hands and cold feet. Now I do not have that anymore. And also, once I cut myself, I broke a bottle of water over my toes and I got cut and it bled very profusely. It was night and I didn't know what to do. Finally, I said, let me just try this TF plus and see what happens. So I broke the TF plus and put it straight on the cut. And in a few seconds, the bleeding stopped. And another thing that I found was that my nurse had a 2-year-old son who had a trigger thumb. And the doctor said that it needs to be operated on. I had no idea whether going to work or not. I said, come on, let's try transfer factor and see whether the trigger thumb will get better. So we get TF twice a day. And after 3 months, he was able to move the thumb better. And after 6 to 8 months, it was fully straightened. And the doctor said no need to have surgery anymore. And another thing that impressed me was one of my downlines had a students, and the mother said that, the son is having COVID and has been having fever, sore throat, and headache, and nothing is helping. So she asked him to try a Ayurveda juice. So the mother gave him 30 ml. And then about 2 to 3 hours later, he told the mother, Mommy, my headache is gone, my fever is gone, no more sore throat. And we found it very hard to believe. But later on, I found that transfer factor works within 2 hours, so that could explain it. So if you have never tried transfer factor, I would like you to try also. And those of you who are planning to have babies, I would strongly advise you to breastfeed your babies because mother's milk have transfer factor, which is given to the mother when you breastfeed your baby, but you must give your colostrum to the baby because it's the highest concentration of transfer factor from the mother's milk. And I'm sure you know that those babies that are breastfed had very much less illness than those who are bottle fed. So if you ever think of having babies, I strongly advise you to breastfeed. And if you have never tried transfer factor, I would strongly advise you to try it for yourself and see if it works for you. Thank you, Dr. Tham.
Okay, thank you, Dr. Joey. I forgot to introduce her. She is
That's
a
okay.
very reputable, very experienced gynecologist for, I think, more than 40 years. So you see the benefit of attending session like this is you get to listen to doctors who don't charge you. If you come and see my clinic, we also charge you. Dr. Joey is a specialist. I see patients that I charge $5, but outside I don't charge. Okay, so you are very blessed to have this kind of sharing with you all. Okay. You see all the studies. If you want, we can ask the person who send it to you. So many studies about this. Science back. It's not just talking, and no substance. Halal, it's Vifanka halal. We have more than 82 patents. Nobody can copy this science. Okay, even if you bring in China, they cannot copy it. Okay. Doctors use, I think, more than 1 million doctors now in the world using this. This is another research done by Professor Hapipa in the University of Malaya Faculty of Science. He said in Malay, he said, I rasa gembira kerana kini rintihan dan keluhan berjuta-juta manusia yang menghadapi berbagai masalah kesihatan telah menemui jalan keluar dari molekul semula jadi kurniaan Tuhan ini. She really found something that is like a gift of life. Ciptaan Tuhan. Being a professor, she comment on this like that, So you can imagine, we have also even one stroke specialist in the northern side. He's so excited about this science. He keep on sharing, keep on sharing, keep on sharing. We have during COVID time, there were a group of doctors in Bolivia, and they found that, wow, this thing really helped, And the side of it is ivermectin as well. So by right, doctor in hospital cannot do a national television like that, outside and advertise the product. But they cannot help it, they are so excited. Okay, so future infectious disease, remember transfer factor, okay? Now, study has also shown that transfer factor is a vaccine of itself because it can activate the immune response. Just like under the gold standard for vaccine control, any vaccine that comes in has to go through this kind of gold standard for vaccine control. And we pass this test. So it's a vaccine by itself, okay? And a lot of studies have shown transfer factor can be used as an option for managing the COVID. Why they never use that? Because cannot make money. Vaccine can make a lot of money, okay? So next time there's an alternative, you can if there's any like TB coming in the world, any new virus coming to the world. I heard next year there's a catastrophic pandemic. So people in here today to listen to this talk, you are preparing for, you don't know what will come next year. Okay, you know what to do, okay? They want the best immune system help since 2017, right up to today. Okay, they want the product of the year in 2023. It's not about Asia brand, no. It's much more than that, no. Okay, this is the award that is given by, they actually done 20,000 companies, no, and then they see which is the best. They also went the best longevity and immune system company of 2024. This is NMM plus. In Singapore, you see a lot of people are careful, they buy a lot of NMM products to take. We are definitely way and cutting edge above NMM product. In fact, this product also got NMM inside, but we have more other ingredients that can superly show that the lifespan, the health span increased by double. So you want to buy this, you order from Singapore to your friend, and then they can send it to you. But you can ask the people who come in. I send a lot out. My this link, they actually a lot of people are buying. Okay, so this is the best longevity product award. They won. A lot of people talk about longevity, anti-aging. They want this kind of award. Okay. So I won't talk about anymore. I give you a time to ask. I actually want to talk about our cellular detox program. It's the most powerful, unbelievable transformation to wellness from our IDX, we call it cellular detox program. The groundbreaking nanotechnology immune science. This is the one that I will talk about the vaccine side effects. Please invite your friends to come for my next talk. Maybe next month I will give this talk because a lot of people are suffering outside. Especially people who have done the Pfizer vaccine, please come for the talk. Because I noticed a lot of people after the vaccine side effects, 3 doses, their heart, the muscles, leg, I don't know what happened, they just dropped down dead. Okay, so please join the study. This is a sharing of science, and there's no alternative in the world now except by Peter McCullough. He has found a formula, but we are definitely much better than that. I will prove to you that we're much better than that. Okay, so please come in and listen to the next talk on vaccine side effects. So I won't talk more about this because of time limitation. So I give you some time, 5 minutes to ask questions because coming at 9:30 already. Anybody want to ask any question? Hui, you see any question on the chat room?
Yes, Dr. Tham, we have one question from Jennifer. She asked about, Dr. Tham, do you mean that all those who had COVID vaccine, regardless Pfizer, AZ, there's a risk of spike protein, autoimmune disease?
Okay, spike protein come from 2 sources. One is from the vaccine, one is from the COVID infection. Now, even worse is spike protein can be passed from exosomes. That means that you breathe. If I close proximity to you, I can pass it to you. So that's the latest finding lah, but so everybody is exposed to spike protein now. I hope I answer your question, but you need to remove that from your bloodstream. You can either use some of the therapies which I will mention in my next talk. So please do come, and people who have done this, please, like Singapore, there's a spike increase of turbo cancer. That means you don't have cancer, suddenly the cancer it become fourth stage. So a lot of people are experiencing this kind of problem in the world, which is not announced, because I do this business and this sharing, I know because people come to me, I see a lot of people just collapsing, dying. Today I just went to a funeral and come back. The wife just collapsed, I asked her why, they say the aorta valve leak. Okay. So any other question?
Another one from Jennifer as well. Because just now, Doctor, you mentioned about NMN. So she's asking about what is NMN.
Or it's anti-aging ingredient. So in Singapore, you can do Google and research. It's a hit thing now lah. Okay. But if you look at our best longevity product as awarded, we are much better. Okay. So if I don't know who invited you. If you need help, you ask the person can help you. You can always contact us. We will share with you all those videos and all these research papers. Then I don't know whether you are concerned about longevity. I had somebody who I asked the person. I say you want to live or you want to spend 800,000 for the machine. The person replied to me, I want to live. So to get one extension of life, they will pay 800,000. This thing will not, you will not really know until you lie in the hospital. So please don't land yourself in the hospital. It's best you keep yourself healthy. Don't land yourself in the hospital because you're in for a lot of side effects like steroids and of course, if it's emergency, no choice. So please take care, focus on your healthcare because hospitals are increased, medical claims are increased. You can see the disease are on the rise. Okay. Any more?
Not anymore from the chat box. If there's anyone who would like to ask any questions, feel free to
One
do
more
so.
question now, then we cut off. All right.
Yeah.
Please make time to attend. I don't even take my dinner. So I don't give myself excuses. No, I have a dinner and all this. Because I see the importance of this talk. And I hope I prepare for it. And I hope this share with people. No, you don't have to be like lady who suffered from the asthma case earlier, remember? That they don't know what to do and now they suffer. They really suffer, I have one case, I can tell stories after stories. 8 years lying on the bed due to the ALE case, It's like a Stephen Hopkins neurological disease, 8 years lying on the bed. But after taking transfer factor, science, the science that helped her, 10 days she walked to Pasar Malam. This is a real case. One person, 5 years coma, less than 10 days, she woke up. I have many miracle cases in this. Until I, all this, I really just keep quiet and just, see people recovering, and my heart just smile and laugh, and feel blessed to share this. So that's why we have this talk. Dr. Jovi also give very good talk. She's a very experienced doctor. She will charge you high specialist fees. When she talk, you must win people. Okay. So here I pass it to you.
Dr. Tan, one last question from Max. He's asking when is the best age to eat supplement?
Good question. Because as we age, everything decline. If you are say 16 above, your immune system drop by 70%. That's why the aged people they have infection very easily. And then you see all the things decline. Your balancing also decline. You walk also like drunken like that. So and then your legs and muscles all all are dropping. Collagen are dropping, protein in your body are dropping, so you really have to take care. You save, you save on other things, you don't invest in the health, you have a big problem yourself. Okay, I visited a rich man, the wife passed away, they are very rich, but they don't really want to spend money on all this kind of thing. So I cannot help lah. Our life is one live once only, must take care. And life is short.
Yep. Doctor, can we take another one last
Yeah.
question from Stephen? He's asking whether TF can help in stroke patients and also help to cure stroke patients who are bedridden.
Okay, depends on the severity of the stroke. If the person can still move, good chance. But make sure the stroke patient in between the 6 months, you must really treat it. And if after 6 months, it's better to treat unless you do a lot of physio. And we have many cases, miracle cases. If we do a talk on heart and stroke, you find that people walk, people move, maybe improve by 40, 50%, maybe not 100%. It can help because we have targeted product on heart. It will increase the blood flow. It will somewhat like TF also will repair the nervous system and all this. You will repair. So better than you must test it, must try it. I say so much like that, like I boast until like everything can like that, but you have to go and try it. I can show you the product top. Okay. We have a stroke patient in the stroke specialist in I won't mention which state in northern state. He really so believe stroke specialist in this product, and he share with all his stroke people. We have physio people who use this product and help his stroke patient. We have unfortunately I think tonight she's not in. She's a physio. She used this to help a lot of stroke patients. Okay, maybe wait for our talk on heart and stroke. Maybe we will share with you more.
Okay, all right. Thank you very much, Dr. Tham, for your precious time, especially on Sunday night, to share with us about immunotherapy and the power of transfer factor. And also thank you everyone for attending tonight. So if you have any further questions, feel free to ask the person who have invited you here tonight. And we will be having weekly health sessions, Zoom sessions as well, in English, in Chinese. So the saying, get back to the person who have invited you tonight. And we hope to have you again and to share with you more about health tips and transfer factor. All right. Thank you, everyone. Stay safe and Happy New Year.
Okay.
Thank you,
Bye-bye.
Dr. Tham.
Bye-bye.
Bye.
Good night, Dr. Tom. and
Bye-bye. Good
everybody.
night. Good night.
Thank you, Dr. Tam.
Thank you,
Happy
Tori.
New Year to all.